Hi, I'm Jim Koski. I'm a physical therapist here at Orthopedic and Spine Center, and today I'd like to show you some exercises to help strengthen the hip that you might want to do before you have a surgery. Okay, so some exercises that you might want to do to prepare for a hip surgery coming up. Here's 6 of them. First one is called a straight leg raise. So you're laying down in bed. I like to have the opposite knee in a bent position. It helps supports the back. You're going to tighten up your quad, and you're going to lift your leg up just about as even to the opposite leg as possible. So Zach lifts it up, puts it down. He's going to do 5 repetitions of this. For you, I'd like you to do 3 sets of 10, okay? You're going to feel a good little burn right up in here. Your muscles are going to be working, that's fine. That's what we're looking for. But we're going to strengthen all sides of the hips with each one of these exercises. So we're strengthening the front part of the hip here. Now I'm going to have Zach go ahead and lay on his right side. Down, the leg that's on the bed is going to stay straight. The top leg's going to stay straight. Now Zach's going to lift this leg straight up towards the ceiling, okay? What I'd like you to do is to lead with the heel, okay? Lead with the heel first. Most of the time when people are having hip pain or weak, they're going to lead with their foot like this. And what we're doing there is you're getting the front muscle again. So try and focus in on leading with the heel to the ceiling, and it'll add a little more spice to the exercise, okay? So once again, 3 sets of 10, all right? And we're strengthening the side of the hip. Now what I'd like to have Zach do is we're going to do some hip internal and external rotation. So he's going to go into what's called a clam position. He's going to bend his knees, okay? His feet are together, knees are together. The first exercise is we're going to go ahead and he's going to keep his feet together. He's going to raise his knee now, his top knee up and then back down. He's going to put it up and back down. So what this does is it's going to keep the hip a little more mobile in this position and these movements, the internal and external rotation, which helps us when we're twisting and turning. Then what he's going to do is you're going to keep your knee together and you're going to spread your feet. So he's going to lift his foot up towards the ceiling and then back down. Lifts his foot up, back down. So now he's getting the other smaller muscles in his hips. Okay, after you do your set of 10 of that, then what I'd like you to do is he's going to roll back over on his back. He's going to keep both knees bent. Now what I'd like to do is I'd like him to just push through the heels. So he's going to lift his toes up. He's going to lift his bottom up off the bed as high as you can. Preferably if you want to be nice and straight, that's a good repetition there. But most people are going to have a hard time with that, so they just lift their bottom up just high enough. Just so we get those the glutes activated. So that's strengthening the back side of our hips. Okay. Now if you're really doing well with this and you want to add a little more kick to it, he's going to go ahead and put this leg out straight and lift it off the floor, off the bed, and he's going to use just his leg, the leg that he's going to have surgery on to lift up. And he goes up and down. Okay. Once again, 3 sets of 10. And hopefully that'll help you get a little prepped for your surgery, and we'll see you when you get done.